News Talk Sports of the Triad, WSJS. I'm Jeffrey Griffin. Happy Monday, John Dunn from HealthTeam Advantage.
Today, I think we'll spend a lot of time talking about HealthTeam Advantage's customer service and how we approach our customers.
Right now, HealthTeam Advantage is viable in what counties, John? It's pop quiz time again, right?
Here we go again. There are 13 counties, so not in alphabetical order, but let's check the boxes here. We've got Guilford, Alamance, Randolph, Rockingham, Forsyth, Davie, Davidson, Yadkin, Stokes, Montgomery, Caswell. Who'd I miss?
Orange.
So every month, just in our 13 counties, there are a few thousand people turning 65 every month. If you just have questions about Medicare and where do I get started, give us a call about that. I tell people, start planning for this 6 months before you know you're going to retire.
Sure. Yeah. And folks, there's also a website you can visit, HTANC.com. That stands for HealthTeam Advantage, NorthCarolina.com, or you can type in HealthTeamAdvantage.com.
Either one will get you at the same place.
You better believe it. And then again, folks, your healthcare concierge. So we just don't call them our customer service people or a rep.
Yeah, that's a fancy term that we kind of throw out there.
I like it.
Give you the 5-star treatment.
Well, it is a little extra bit of loving, right?
It is. It's a lot of loving, a lot of hand holding, because we want you to know what exactly is going on. If you have a question, we want you to have that freedom to call, feel comfortable with us, so that we can dig down and help you out.
Yeah, and you're going to have the same person time after time. If they're not available, maybe they're in a conversation with somebody else.
That's right.
So you can leave a message, or
that's kind of how we have built the model for our customer service. Is when you join HealthTeam Advantage, you are assigned your own healthcare concierge.
For some of us, we want to sit down, have a face-to-face meeting. I want to bring my papers, bring my medicines, show you all my stuff.
That's right.
And have somebody sit there and go through it with me. That is also an option for you.
It is. So that was kind of one thing we took away out of all of the COVID lockdowns is, even though during that time, some people were scared to get out, when it was over, people were looking for a solution of, hey, I still want to see people face to face. If I've got a bill I have a question about, I still want to bring it to somebody to physically look at and explain to me. So with all of that in mind, we decided to open in December what we call our local benefits center, LBC for short.
All right. And where is it?
It is in High Point. If you know where Palladium Theaters are, there in High Point, it's right across the street from there.
Sure, and easy to get there, whether you're in Greensboro, Winston-Salem, Thomasville.
That's right. Just
you're in Walnut Cove.
Come up Wendover, go 68 or Eastchester, and you're right there at us.
So it is 5815 Samet Drive in High Point, and the hours for the LBC?
9 a.m. to 4 p.m. Monday through Friday.
And John, I guess it's one of those things of folks being responsible. Older folks, I think, tend to be a little more responsible than younger folks, this kind of thing. Do we need to make an appointment?
You do not.
Oh, just come on.
We welcome you just to drop in. We'll give you a cup of coffee or a bottle of water or a soft drink while we sit down and chat with you.
Hey, folks. So if it's face-to-face and that makes you feel better, and sometimes, it's an adult kid too.
Oh, absolutely. Yes. A lot of times you have a senior that's like, hey, can let me bring my adult child in to help me understand some of this. They're asking me questions and I don't know the answer to.
Right. And you say, well, I spoke to this pleasant person on the phone. And then as the adult kid, you go, well, mama, daddy,
did you ask this?
Did you need to sit there? I'm still not sure. So it just puts everybody's mind at ease.
That's right.
Where you can sit down and have a conversation like you were sitting at your own dinner table.
Yes. And don't get upset with us when we ask you, because now we have to with all the HIPAA regulations. Is it okay to discuss your personal information in front of this person, even though they're your child or your spouse? Don't get upset when we ask you that.
And so that's also, then it's more, you get more of that sense of we're all looking out for you. Sure. Now, John, there are a lot of questions, and we talked about, to start maybe 6 months before your 65th birthday.
That's right. That's what I tell people. Start planning that far ahead. Because there are some things you have to do with Social Security to trigger Medicare. So you want to start that process early enough. You're not going to get billed or have a payment due before your 65th birthday. So don't worry that I've got to come up with some money out of pocket. just to get started. No, let's just get the process started. So you have everything in place by the first of the month of your 65th birthday.
Yeah, and it's not like you're going to put an end to something else. You've already made arrangements. If you're still at work,
that's right.
You decided, yeah, I like my job. I'm gonna keep on doing.
That's right. And if you're provided a group health plan at work, you can keep that in place. But we want to let Medicare know that's what you're doing.
Yeah, so that's why don't put it off. Did you know that there are 4 parts to Medicare? A, B, C, and D. John's going to talk you through those. And we have one part that we're particularly fond of, so we'll get to that. And there's some acronyms which will help you get you on your way.
So we'll start with Part A. That is the part that you automatically get with no additional cost if you have worked 10 years throughout your lifetime.
40 quarters.
40 quarters.
40 quarters.
So there, you see that deduction out of your paycheck each week or every other week for Medicare. That's what that's going to pay for, is your Part A.
Okay. You can check that out on the Social Security website.
You sure can.
Any old time, see where you are, because those are updated in real time.
Oh, they are. Yes.
So you know where
you're at. Yeah. So that takes care of Part A, and that covers hospitalizations pretty much.
Sure.
So if you're admitted to the hospital, that's where your Part A is going to come in. Okay. Then you have Part B, and you have to pay for Part B.
All right.
That comes with a monthly premium, unless you qualify for Medicaid, and then Medicaid will help. It will cover the cost.
And differentiate. Medicare is a national program,
right? Medicaid
is state by state.
That's right. Okay. Income based. And Part B gives you coverage for your outpatient procedures, outpatient doctor's office visits, those type of things. And pretty much anything outpatient is B. All right. So that's your A and B coverage.
And together they are known as?
Well, we're going to skip to Part D first to talk about drugs. Part D is your drug coverage.
All right.
And that is sold through individual health insurance plans or health insurance companies. And you will elect a Part D plan that will cover your prescription drugs. They'll have a monthly premium with that. You'll have copays for drugs, and some plans will have a deductible for drugs. Now we come to Part C, the part we all like, because that takes A, B, and D and combined them all very nicely into one neat package under a Part C or Medicare Advantage plan.
Okay.
So you get your hospital, you get your outpatient, you get your drugs. And most of our Medicare Advantage plans in our area will also cover things like dental, which is not covered by Medicare.
Sure.
You would think something as big as dental would be, but Medicare says, no, we don't cover any dental.
All right.
But a Part C plan usually picks up dental coverage, routine vision coverage, which is not a Medicare covered expense.
And again, you would think particularly folks that are getting older, vision would be high on the list of things that you want to take care of.
Oh, absolutely. Yes. And then hearing as well.
Yeah.
And then some of the other benefits like a gym membership program, Silver Sneakers. Which it's just not a gym membership for physical activity, although that's a big part of it. Another big part of it is the social aspect of going somewhere to meet your friends, stay active, not just physically, but mentally. Yeah. And the big question we get is, just about every Medicare Advantage or Part C plan in the triad is a zero premium. Was like, how does that happen, John? How can a health insurance company do all of this with zero premiums? Keep in mind, all of these years you've worked, you've paid into Medicare.
Sure.
And that's how an insurance company gets paid, is from Medicare.
So you've been investing in your own healthcare coverage all these decades.
You've been paying for it all of these years. Take advantage of it. Use it.
Sure. All right. So that's great. And some things, John, that we really just throw these out there. You can't say it enough. Some of the questions, some of the conversation that you absolutely should have with family members and your healthcare concierge and your medical providers. You talk about at the top of the list, almost for everybody, your prescription drug prices.
Number one thing is every year you want to sit down, either call us at HealthTeam Advantage, or if you have an agent that you deal with, give that agent your updated list of prescription drugs. That is the number one driving cost of healthcare, are prescription drugs. So be sure you're on the plan that gives you the least amount out of your pocket to cover those prescription drugs.
So if you're on the phone, that's great. We can describe it. You can spell the word if you don't know how to say it. Or if you go to the local benefit center on Samet Drive in High Point, bring your bag of medicine. We know you got them in a grocery bag.
That's exactly right.
Just bring them on, put them on the table. We'll go through it, right? I keep mine the same way.
Yes. And you know, your chart at either Novon or Atrium or Cone or whatever system your provider is a part of, they have my chart.
Mm-hmm.
Look in your chart, print off your list of prescriptions because they'll be there.
Yeah, and you know that list can change easily, John.
Oh, it can change at just one doctor's visit. Oh, we get some interaction here. Let's change up this drug or that drug.
Sure.
So that can happen at any time.
So if you start to feel overwhelmed, like how do you keep up? No, you are not alone. John, I kid you not. I had a doctor's visit recently. They were going down my list of medicines.
Yep.
90% of what was on that list was wrong. It had changed from my last visit.
Right.
No, not that. And yes, this and that. And so we had to go in there to take 5 minutes of your time.
That's
but
right.
You want that list to be up to date.
Up to date.
And also the other reason that, how much is it going to cost when I go to the drugstore and get my prescriptions for the month?
You've got to know that.
That's
Nothing
not a
worse
surprise
than being at the register and get the surprise.
Mm-hmm. HMO versus PPO.
All right. So we'll start with a PPO. That is the most inclusive. So you have a PPO, and when you hear those three letters, it's talking about the network of providers that are contracted with a particular health insurance company.
So the net is a little bigger in a PPO?
It can be, but it gives you coverage outside of that network.
Right.
So you can go to a doctor that is not part of that company's network and still have coverage.
Okay.
You may have a little higher copay, but you can still go to that provider, be seen, and it will be covered. HMO gives you no out-of-network coverage.
All right.
So you have to go to a provider that is in that company's network of doctors.
So if the doctor says, I want you to see this kind of specialist, I recommend Bob.
Right.
If Bob's not in your HMO, you would have to say, I need another Bob.
But how do you know that?
So you call your healthcare concierge.
Now, that in-network provider should not be referring you out of network, but
mistakes happen. It could happen.
It could happen.
And one more thing before we move on to the chronic special needs plan, just real briefly. What if I'm out of town, visiting friends, on vacation, an emergency rolls up? Where am I?
Great question, Jeffrey. So any emergency, you are treated just like you're in your network at home.
Sure.
So don't expect to go somewhere and be denied coverage or get home and have a bigger bill than what you anticipated. If you're out of network and you have an emergency, you're treated just like you're in network as far as your co-pays, co-insurances, all of that.
And the last thing we want is for you to put off going to the doctor, and especially in an emergency situation.
Absolutely. Do not put it off. Have peace of mind. You're going to be covered just like you're at home. And even if you're outside of the country, our plans have foreign travel coverage as well.
Oh, so okay.
You know, if not just at home do you have coverage on vacation, visiting for family out of town, but even outside of the country, you have coverage as well.
Yeah, when you're finally old enough to have the good sense on what the value of travel, you can get out and enjoy it, right?
Enjoy it.
And so you don't have to worry about that.
No, that's right.
What if I get the flu when I'm on safari? Go to the doctor.
You know, that probably the number one claim that we get for people traveling outside of the country is getting sick on a cruise ship.
Is that right? I guess that makes a lot of sense. I can see that now.
So yes, you've got coverage for that.
There you go. And John, chronic special needs plan, this is a really big deal.
Huge deal, Jeffrey. And, you know, I think there's one other chronic special needs plan in the triad other than HealthTeam Advantage, but we've had it the longest. It works great for our members. We see members that allow us to help them manage this chronic condition actually getting better, having less time at a hospital stay, having a better quality of life. So, you know, for us, it's if you have diabetes, and it can be type 1, type 2, doesn't matter, or if you have congestive heart failure. Either one of those chronic conditions, we've got a plan for you. And we help you manage that condition, not because we want control of it, but we want you to have a better quality of life.
Sure. Or you're working with a cardiologist, with an endocrinologist, with a podiatrist, which is
That's
so
right.
essential
Oh,
for
absolutely.
folks with a diabetes diagnosis.
And knowing that on that particular plan, those specialists are zero copay. So we don't want to forget those folks either. If you are under 65 and are disabled, give us a call.
Yeah, and maybe you're not sure what the disability
Right.
diagnosis is, then what better reason do you need to have that conversation?
That's
Go ahead and
right.
give them a call, and then you can get the clear answer, the
Yes.
correct answer, and make the decision that's best for you and
That's
your
right.
medical circumstance. I'm Jeffrey Griffin for John Dunn and Christian Snyder. Thanks for being with us.
That's all for this segment of Medicare Monday from HealthTeam Advantage, originally broadcast on WSJS in North Carolina.
News Talk Sports of the Triad, WSJS. I'm Jeffrey Griffin. News Talk Sports of the Triad, WSJS. I'm Jeffrey Griffin.